We've had over 400 positive cases of flu that we have seen here at UF Health. That is a lot more than what we've seen in prior seasons. About a quarter of those people are ill enough to be admitted to our hospital, but that also means that 3/4 of people actually can be sent home to recuperate at home with antiviral medication. Every year, flu peaks at a different month, so for example, 2 years ago it peaked in March, So I would say during the peak month for flu, we would see perhaps 300, maybe 350, I think might have been our last peak, our highest peak prior to this year, recognizing though that the month is not over and we've already had over 400. So this is the most we've seen in quite some time. Influenza is a little bit different from a lot of other respiratory infections because it often comes on you very suddenly. So people sometimes can even say, I was feeling fine, and then after lunch I've had the chills, the shakes, and I felt terrible. That's pretty characteristic of influenza infection. People who even have a little bit of a slower onset will oftentimes get worse pretty rapidly, and that's very different from the common cold, for example. So other symptoms that go along with it would be coughing, sneezing, you can have a runny nose, you could have a fever. Not everyone has fever though. Body aches, headache. Some people will also have nausea, vomiting, or diarrhea as well. So you can be pretty miserable when you get the flu. We're going to restrict the number of visitors that a patient can have. And the reason for this is that we want to try to limit the number of people who might be infected with flu from coming into the hospital. Flu is a really tricky virus in that you can be infectious. In other words, you can transmit influenza infection a full 24 hours before you have symptoms. So that means if you look to your left, look to your right, the people around you, one of them could be incubating flu right now and feel perfectly fine and could be transmitting it. So that's the reason why we really want to limit the number of visitors that are coming into the hospital. We are also encouraging people to wear masks when they are in the hospital as well, because that will also help to cut down on flu transmission. If you come to the hospital though and you are visibly ill and you are not there as a patient, but you're accompanying a patient, we're going to ask you please not to visit because again, we are trying to limit the spread of flu. We're going to also restrict the visitation by children in the hospital. And there's a few reasons for that. Children can transmit the flu just like adults can as well, but it's very difficult to get especially small children to wear a mask properly just because their heads, their faces are smaller as well. And again, in order to keep people as safe as possible, we want to limit that. Another big part of trying to prevent the transmission of flu is going to be hand hygiene. So in numerous places throughout the hospital and throughout the hospital units, we have alcohol dispensers for hand gel. And so using this hand gel is going to also help reduce the spread of flu, since we know it can be transmitted in that way as well. If you haven't been vaccinated for flu, but you got the flu, you should still get vaccinated. Because like I said, depending on which vaccine you get, there's between 3 and 4 vaccine strains in it. And when you get the flu, you just get one. So you're still at risk for getting one of the other ones that are out there. And we've seen that in the past, people getting flu more than once in a season because they're getting infected with a different strain that's circulating. The other thing that vaccination does for you is it lessens the severity of the illness. And this has been shown in a lot of different studies. So that could be the difference between being able to take a pill and go home versus having to be admitted because your breathing is so impaired. So vaccination is really important, not just to prevent flu, but to decrease the severity of it.